Good morning, and welcome. Welcome to our Saturday morning tea. Here, we brew up the hottest topics in healthcare. We discuss health information, news, education, certification tips, entrepreneurship, and everything around the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button. I am Clarice Warner. I am the girl with the pearls. Yeah. The founder and senior education director of the Professional Reimbursement Network LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask you, do you know what it takes to be a certified marketable medical coder? Do you? Well, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check out the video description for the link. Now, normally joining me is my partner in success, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. However, he is feeling under the weather today, so I'm all you got. So let's make it what it needs to be, shall we? Okay, let's see who we got. Good morning, Carolyn. Good morning. How are you? Welcome. How was your week? Hopefully everything went well. Now, before we jump in, let me remind you that you can join in and add to the conversation because it's going to be me and y'all today. So don't be shy. Your opinion matters and is always welcomed here. So feel free to use the chat. If you have a question for me, you can place a Q first so that I know it's a question for me and you're not asking a question to someone else in the chat. So, yeah. Hey. Good. I'm doing well. We had our first snow here the other day. It wasn't bad, but it was snow. It was pretty. Unfortunately, of course, I had to be out there in it, but it was still it would have been prettier if I was at home looking out the window, but it was still pretty. But it wasn't too bad. Grand Rising Queen. Good morning, Renita. Welcome. I know that was like saying it twice by saying good morning and Grand Rising, but it's a habit. Oh yeah, the snow is great. It's pretty, especially fresh fallen snow. It's just gorgeous. And actually, while I know this is treacherous to folks, I like ice storms. To see the ice on the trees and it's just glistening. It's like just a magical thing. And so I love that. And so I'll venture off trying not to fall and kill myself and actually take pictures of them. I love them. I think it's so pretty. Okay. I saw the snow when Cleveland played Pittsburgh. Both of my non-favorite teams. But okay, yeah. I'm a Bengals fan. We don't play with them other people. But yes, that was the snow. Not I saw it at a game. Okay. Really? Here we go. No, I'm kidding. It's hot during the day here in Arizona. I know. I've been to Arizona and it was no joke. And we went, was it in the fall? It was in the fall and it was still relatively warm in the daytime. So much so that you had to run for cover. Yeah. Good morning, Tanika. Welcome. All right. So let's see. So for those of you who are just joining us, or joining me. See, I'm used to an us or watching the replay. No, us. They can come. They can join us. It's all of us here in the room. All right, all right. Or watching the replay. Today we are talking about Think Smart, Code Right, the coder's success formula. Yeah, we're going to focus in on our health information coders today. So, but first, our church announcements, even though I don't have my fan, but we can still have our church announcements, can't we? Yes, we can. Look at y'all talking amongst yourselves. I love it. I love it. Let me play our little background music. I can still get a double clap. Yes. Hey, hey. Nothing like that, that organ boy. Nothing like it. Yeah. For church announcement today, if you were here last week or if you watched the episode 137, we talked about compliance, all about the compliance plans, primarily for physician and small group practices. Well, guess what came out this week, y'all? I won't go into detail, but I said, boy, folks must be listening to me or paying attention. Or we just in alignment with what's happening out here in these worlds. Let me just say that. So this is what came out this week. So this week, we were blessed with the nursing facility industry segment specific compliance program guidance. Yes. So this applies to all individuals and entities involved in the healthcare industry, these particular program compliance guidances. And this one is the guidance for nursing facilities. Nursing facilities can use this to help identify their own risk and implement an effective compliance and quality program to reduce those risks. So just real brief, because I won't go into it and I may use this for a different segment, but some of the things that they have in here that there's an introduction, there's a user guide on how to use it, compliance risk areas and recommendations for mitigation, other compliance, quality, and resident safety considerations, and then there's a conclusion. And then there's the supplement, which is probably where I will focus when if I pick this up and talk about it, is the reimbursement overview. And so the document provides an overview of Medicare and Medicaid reimbursement for nursing facilities as context for certain risk areas described in the nursing facility ICPG. So yes, that came out this week. Like I said, somebody must have been listening to us because it came right out on the heels of us talking about the physician guidance. Okay, and okay. Good morning, good morning. Good morning, Crafty Coder. Good morning. Okay, and the other announcement is I attended, I don't know if you attended, but if you did, you had a good time. I attended the CPT Coding Symposium for 2025 this week. Always a good time. We'll talk more about that and other things in the meeting after the meeting, but I will say it is a joy to have your regulators, so they have people from CMS as well as the physicians and regulatory folks at the AMA discussing all of the changes all of the codes, all of the things. They break down each section of your CPT book. It's a time had by all. Also included with lunch and a dance party break. And then they had some really good special sessions. Again, we'll talk more about all of that and for the PRNT sippers at the meeting after the meeting. So those were, good morning, Dr. Jasmine. Welcome, welcome. So we'll talk all about that in the meeting after the meeting. Stop all of the church announcements that happen. Okay, so let's get into today's topic and let the tea spilling begin. So again, today I have a Yogi Stash blend. And of course, it is always the business. I have three tea bags. And then the quotes on my Yogi tea is compassion is your strength is one of them. And the other one is lift up others with your peaceful presence. Oh, yes. And that may be so timely for us as we enter into this Thanksgiving season and gathering and all of the things. So yeah, keep that with you as you meet with it, everyone. So with that all being said, let's talk about how you can absolutely transform your coding career just by using your critical thinking skills. And today we want to talk about some frameworks that actually will help you in that. And I know we've talked about critical thinking and how coders can be so much more successful if they really just apply critical thinking skills. But then it dawned on me, maybe people don't even know what critical thinking is, or maybe people are not really sure. Like we use it and it's kind of like a buzzword, if you will. Maybe people aren't really familiar. So I thought, let's have a conversation. Let's talk about it. Let's kind of think about or provide some information on what we mean when we talk critical thinking and coding. And so that's what we're going to talk about today. So let me just ask you, have you ever kind of stared at a medical record, not knowing that something wasn't adding up or something wasn't quite right, but you couldn't put your finger on it and you were like, well, wait a minute, what is this? One and one is not equaling two here. There's some other things happening. Or maybe, you felt some kind of way. We get that intuition in our gut when submitting the codes, and then you wonder, well, maybe I missed something, or did I make sure I looked at everything? Did I do all of the things? Well, today we're going to talk about all of that and how to change some of those feelings that you may have when we're looking at these records. Now, I want to tell you, in honor of my co-host, we're going to do some inpatient. So we're going to talk a little bit about critical thinking from the inpatient perspective. And yes, I will have something for my outpatient and professional coders as well. My peeps. We're going to talk about them as well. So first, let's think about a documentation analysis. So every time you look at a chart, every time you get that documentation, you need to make sure that everything is what it is and that it all matches up. So this is where most of our coders go wrong, is in that initial review. They want to jump right into coding it before actually getting a full picture of what has happened. So what I want you to think about and what I want you to do is, and again, this is for my inpatient friends. I'm going to deal with y'all first, and then we're going to transfer over to professional. But read the HMP, read what happened, read what's the story, how the story begins. How you build up, because especially in inpatient, it is just a complete story of the care that the patient received while in the facility. Also, review the discharge summary. Scan some of the progress notes. You want to make sure things are ticking in time. You want to make sure that you can follow the progression of what actually happened. And then if there are consultations, if other providers are looking at this patient, you want to make sure you look at those consultation reports as well. Because again, you may find some telling tales in those additional eyes that are on this particular patient. So look at those as well. So again, spend that extra 5-10 minutes upfront to save you hours of rework later. So that's one of the things. Another thing is you can kind of look at your clinical validation. So this is where you put on your detective hat, if you will, and you're looking for clinical indicators, you're looking for lab values, you're looking for diagnostic tests and treatment plans. So you're looking for the stuff to support what may or may not be documented for that particular patient. So and let me give you an example. So say you have a person who coded malnutrition because it was documented and they saw it and they said, okay, well, it's here, let me do my job and code what I see. But you look deeper. There wasn't a dietitian consult. There was normal abdomen. There was no weight loss. There was no intervention. There wasn't anything. So you see where that may be a problem, because there really wasn't anything to support that. There wasn't any clinical documentation to support the code of malnutrition. And so this is where, again, putting on that detective hat will help you kind of think through, okay, well, what is this right? Maybe I need to talk to somebody. Maybe I need to query someone to get some additional information about why the need for the diagnosis of malnutrition. Another thing you can do is build your critical thinking toolkit. So let's talk about that. Every professional coder needs to know where to find clinical evidence. I say this all the time. We are clinical people. While we may not be, well, most of us are not and never have, at the bedside and providing the clinical care, we all have been taught, especially if you've gone to any, depending on your program, I'll say that, most programs include the clinical information and clinical validation and all of those things. I will say, if you've attended a KHIM accredited school, you definitely have been taught information about clinical validation, AMP, pharmacology, all of those things that will get you thinking about, okay, let me make sure clinically all of this stuff adds up. So some of your resources, and I'll just give you a couple initially, of course, your official coding guidelines. Those are there to assist you and help you in navigating this clinical validation piece. You also have clinical criteria from medical references. Your coding clinic guidance is also a very good one to use. And then there are facility specific protocols. So know the protocols of the facility in which you're working or the system in which you're working. There may be things that, they have expertise in and they may specialize in, and they may have developed their own protocols. And so make sure you are familiar with those as you are reviewing documentation, as you're reviewing those charts that will assist you in making sure that you are using your critical thinking hat to determine the accuracy of the coding that you're providing. Another thing that you can do is create your own quick reference guide. I keep, y'all know I like to write, and I keep binders and lists and all kinds of things. I'm trying to transfer over into the electronic world. I'm trying, but I just like to write. So I keep notebooks, and I have all the, I'm about receipts. So I keep notebooks and receipts of all of the things that help me when I am looking for specific things as it relates to clinical validation. So put together something that will help you as you are thinking about, okay, well, I code from this particular specialty, and these are the places that have like some good reference material so that you know where they are. Or, well, I do this on my computer. I am kind of in the electronic age. I use Mac everything. And so I use my notes, and I will highlight or create a note with, various links to websites that I go to, that I can say, okay, let me go in and check and see if there's any information regarding this, or if there's any information regarding that. So yeah, you can create your own little quick reference guide. The other thing is the clinical connection process. So this is where the magic happens, and this is where you can connect all of those clinical docs. So when reviewing documentation, ask yourself, do the diagnostic findings support the diagnosis? Does the treatment match the condition? And are there contradictions in the documentation? So if somebody's saying one thing and then maybe somebody else is saying something else, or did the lab's results say one thing and somebody is saying something else? Those should be examples where your eyebrows raise and you're like, wait a minute, what's happening here? And also, is there a cause and effect relationship happening? Take note of those things, because again, that can assist you with your accurate coding, depending on what the diagnoses are. So let's look at kind of something that makes kind of sense and ties it all together. So quality assurance. Before you finalize those codes, you can implement kind of a fact check, or if you will, or quality check, if you will, to make sure all of this stuff happens. So does it make clinical sense? Does all of this stuff, when you're looking at it, does it make sense? And you're like, okay, yes, it does make sense. Is it supported by the documentation? Again, as we mentioned with the example of the malnutrition, yeah, it was documented by the provider, but there wasn't any support for that documentation. And if you see something, this may be, again, the opportunity for you to query a physician and say, hey, sir, ma'am, I noticed that you had so and so and so, and you craft, your compliant query to ask them more information about the diagnosis that they documented. And then make sure you've checked all relevant guidelines. Now remember, the quality isn't about being perfect, it's about being thorough. And so again, taking the time, and I know I hear you all in my head. I hear you. We have these productivity metrics, and we have to make sure we get so many things out. But trust and believe, embedded in that is a quality metrics. And so you want to make sure your quality is top notch. You can push out whatever it is out the door, but if the quality is not right, is it really right? Is it really worth it? Because remember, it's a revenue cycle, and somewhere downstream, someone is going to have to deal with the quality piece of it. So why not make sure you're doing your part in validating and checking quality and reviewing documentation and making sure they're supporting documentation while you're doing your coding piece? You know what? We're all in this together, right? Right. Okay, so now before I give you some insights to my friends on the outpatient side of the world, or the professional coding side of the world, let me put you up on a little game. So here are some key resources for clinical criteria guidance and coding. I mentioned your official coding guidelines. So yes, your ICD-10 official guidelines, coding clinic guidance, your CPT assistant, and the AHA coding clinic for HCPCS. These are all official clinical guidelines that can help you. You also have medical reference resources that are available to you. MCG or Milliman Care guidelines, interqual criteria, the Merck manual, and of course, your medical dictionaries. When in doubt, pull out the dust off that medical dictionary. You probably can look it up online now, but you can dust off those medical dictionaries and take a look at them. They provide a wealth of knowledge and information about the clinical things that you're looking for. And so if you don't know, and I don't think anybody expects you to know, or unless you're the provider, to be able to off top, spew out some of the guidance, but you have references, you have resources. You can go and look for yourself to see what those things are and whether or not it all matches up in the documentation. Again, we can use our professional organizations, AHIMA, the American Health Information Management Association, ACTIS, the Association of Clinical Documentation Integrity Specialists, specialty specific organizations like the American College of Cardiology, and the AAPC, the American Academy of Professional Coders. These are all professional organizations that may also have additional guidance, reference materials, articles, those types of things, especially if you are coding in a particular specialty. It's always good to really go to those specialty specific organizations and see what they're talking about. What are the protocols? And again, they may align with what your facility protocols are. They should at some point, but this kind of keeps you up on game. Again, some additional facility specific resources. I've mentioned facility clinical protocols. What about your internal coding guidelines? The particular facility in which you're working may have internal coding guidelines based on history, based on things that they have encountered over the years for particular conditions or particular encounters. So make sure you are familiarizing yourself with those as well. Your department policies. Policies are there for a reason. Make sure you are understanding what those policies are around certain coding for that particular facility. Yeah, we have overarching guidance and guidelines, but there may be some specific things that again may have occurred at a particular facility that they want to make sure you capture da 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 da. That may be on top of what the professional guidance is. So again, familiarize yourself with that. And then your clinical documentation integrity guidelines. That information is valuable and a gem as well. So make sure you familiarize yourself with that as well. Then you have your government or regulatory sources, CMS. Always go check out what they're talking about. What are they saying? They're the ones that are going to pay you, right? So make sure you know. And then even for your, if you know, commercial payer situations, and this probably is more applicable to, well, I guess you could use it on either side. But we would probably more often than not look at some commercial things on the outpatient side quicker because we don't have the volume of documentation that you all have on the inpatient side. But you may be able to go out and check and see, well, what is the guidance? What are their guidance saying? Especially with these managed Medicare and managed Medicaid offerings. You know, they out here running wild and living rogue. And so make sure you know what their guidance is and what their stand is on certain conditions and certain things that may be applicable to you. Your national coverage determinations or NDCs, oh my God, wealth of information. They will specifically tell you and guide you through, hey, did the patient did they do this? Did they do this? Did they do this? If they did, then you may be able to code this. If you have da 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 da. I mean, they pretty much just spell out all of the things that must be documented, all of the things that must be there in that chart, in that record for that patient in order for certain services or certain procedures to be reimbursed. You also have LCDs or local coverage determinations. We're all over, I think globally, we're all over the world, but for for the United States, for for our reimbursement methodology in healthcare, different strokes for different folks in different states. So make sure that you are abreast of any LCDs that may be applicable to your area as well. And then the National Institutes of Health also have clinical guidelines. Check those out. They, again, may be a regulatory source for you in determining some of the critical thinking that is necessary for you to be the best coder you can be. Some additional clinical resources, of course, medical specialty journals, evidence-based practice guidelines, clinical pathways that may be out there on the rise, disease-specific criteria like the rifle criteria for kidney injury or NYHA for, and they may say that NIA maybe, for heart failure. So there are disease specific criteria that, pretty much they're, if you look at them, they're really like a checklist. Make sure this is done, this is done, this is done, this is done. And then that will help you in your critical thinking journey as you review the documentation to say, okay, did we do all of this? Do we have the documentation to support this? Again, you're kind of, while the clinician and the care providers are that front line providing that care and documenting the information, you're the front line to the reimbursement. So again, making sure you do your due diligence in assisting in that reimbursement journey is key and critical. Okay. So again, those are some things that you can think about from an inpatient perspective, even though some of them, outpatient, professional, there were some gems in there for you too as well. But I want to transition over a little bit to thinking critically from an outpatient or professional perspective. Sometimes folks struggle with the medical decision making or getting lost in new guidelines. So again, let's kind of look at a framework for analyzing your office visits, and then kind of considering how to evaluate the documentation. Again, clinical, the understanding the clinical complexity of what is happening is key. That's going to make you a strong coder. I know we talk about, AI and what AI may or may not do. AI can't think like you. You bring that additional human touch to the table. And so making sure that you position yourself well by understanding and knowing these are the things that make okay coders, well, the cream of the crop coders stand out from the okay coders. How about that? I'll say it that way. So these are the things that you need to put into your toolkit in making you as successful a coder as you can be, because anybody can take a multiple choice exam and pass them, right? Did I say that? Wait a minute. Hold on. Let me. Okay. Anyway, so let's talk about that. So, okay, are you looking at audit tools and counting bullets? We have, I think the AMA also has a tool, and I think other folks have been pulling out tools. And I know I created something a while back trying to, and this was just for the outpatient side, trying to kind of pull together, if you have this, once you've analyzed the documentation, then you can determine what the level of service is. So there's lots and lots and lots and lots of tools. However, I'm sorry, y'all silly. However, yeah, we still use them. But I don't want you to just be, counting bullets. You really need to think about what it is that you're looking at. You really need to think about, what is this documentation really telling me and telling, the payer and telling any other professional that needs to provide care to that. You really have to, think critically about that. And doing that will help in reducing your denials, believe it or not, and can help you in capturing, revenue. So you can be that star in the office because you're making sure that you're doing what is necessary in order for you not only to get the revenue, but, let me put on my compliance hat, but keep the revenue as well, right? Right. Okay. So while templates are all the rave, everybody loves templates. Templates are easy, and templates help our providers document appropriate. They can still be a trap, right? So, and they could be our worst enemy in E&M coding, because people just click off on the template and it's like, well, you ain't saying anything else, sir, ma'am. Can you provide some information? Is there something that I could use to help me here? But let's talk about why. So with the documentation review, you don't want to just count bullet points. That's not the jam in making sure that this will be the optimized level of service based on the documentation. Also, you want to look at the patient's story. Really, I know we're only coding for a particular encounter. I get that. However, oftentimes you're privy to the encounter before and maybe the encounter before that. It's okay to review those previous visits so you can get a full understanding of what is happening or what has happened for this particular patient. That adds strength to the accuracy of the coding that you're providing. And then it also allows you to understand the clinical progression. Is this patient is this patient doing better? Is this patient doing worse? What has happened in especially if you are coding patients that have chronic conditions that they're coming in, maybe every 6 months, every 3 months, that type of thing. So you can kind of follow the progression, and that helps you with the template, and that helps you with the audit tool to understand, okay, this is actually what is happening for at this visit based on what I've seen before. And that gives you a really good, accurate picture of how to level that particular service. So remember back in the days where you had providers, and this is when we used other criteria to level E&M services like history and the exam. Not to say that those things can't still be documented because they should, but we're just using the medical decision making to level the service. But remember when you would see things like a person would come in with like allergies or something, and then you would see on a template that every single bullet was documented or checked off or circled or whatever. You like, really? Did you have to do that extensive of an exam just because somebody came in with some allergies? Really? Make it make sense. Okay. Make it make clinical sense. How about that? Okay. So for the clinical necessity, remember, medical necessity is the overarching criterion. They tell you that. CMS preaches that. You can see it in all of their documentation. And so think about, why was something reviewed? Was it necessary for that to be reviewed? Was it necessary for that is that part of the medical necessity? How does it relate to the presenting problem? What is happening? Are they providing enough information or telling you enough about the presenting problem for you to get a good understanding to critically think about, okay, I saw that the last time they were here, this was what's going on. These were the lab values. This is, that. So you can kind of see and you map out. And especially if you're coding in a particular specialty where you're seeing the same type of patient over and over again, at some point the stuff should be clicking in and sinking in and, living inside of you like, okay, I can pretty much see right, within a couple of seconds, this is not that or vice versa. And then does the workup match the condition? Did they do what was necessary for what the patient presented with and what they are assessing the patient has? Like, again, critical thinking through all of those things. Again, that helps you stand out as a wonderful, wonderful coder. So breaking down the medical decision-making components, again, you have the 3 key areas where you're looking at the number and complexity of problems. Again, it's not just about counting the diseases. You need to know about the complexity of those problems. Sometimes your provider may, and I know we like nice, clean, and easy. We like them to say, oh, this was a chronic so and so and so. But how often do they really do that? Really? Well, sometimes it takes us to take a few moments and let me for real look through this to see, is this a chronic condition? And maybe they did not document whatever that you're looking for on that particular encounter for that day. But again, if we're looking through the progression of that patient, we can kind of see that. And maybe that's an opportunity for a query of a physician as well, to make sure that they're documenting appropriately. But also, and I think we talked about this before when we were reviewing someone's critique of a physician. We had the physician and we had a coder, and they were going back and forth. And while I saw exactly what the physician said, because the way in which they documented it was there, but because it wasn't neat and pretty in a bow for the coder, they didn't. And I was like, that isn't a provider documentation issue. That's a coder understanding, validating, critical thinking issue. Right? Right. Okay. So anyway, with your number and complexity of problems, you're looking at acute versus chronic, stable versus worsening, and any risk factors and complications. Again, that may not be nice and neatly written out in the assessment. It may be throughout the course of the documentation of that note. And so you need to be able to pull that information out of that to support that. Also, with our data review, we're not just counting tests. But you also need to understand why those particular tests were ordered and how the results may impact care. Again, this helps you clinically validate what's happening for this particular patient in this encounter. And then we have our risk. We're looking at the whole clinical picture at this point, understanding what treatment risks are and any comorbidity impacts to this patient. Based on, again, the assessment, based on the data review, and based on the risk that is documented within that particular note. So again, focus on the clinical thought process, not just, documentation elements. That, again, will help you tremendously in your career as a coder. So, and kind of, I know most people, especially if they're coming out of a coding program, if they're getting their coding certificate, receive their coding certifications, all of the things, you're taught one thing in textbook, and then oftentimes, we have programs that will provide you some real world encounters and real world experiences. Pay attention to that, because it's going to be different once you get, because you don't have your instructor, professor, or whomever coming behind you to check you to say, okay, yeah, you did a great job. No, you're on your own at that point. So you need to make sure that you have the necessary skills and necessary tools correctly. Yeah, absolutely. Wait a minute, Dr. Jasmine, let me put your... So that's why it's important to use more experiential learning and cases into coding, education, and training. Absolutely. Coding is not prescriptive. It's not always packaged neatly. Absolutely. And that helps you stand out as one of the best coders, right? Because you've taken the time to understand it's more than just saying, okay, oh, here's a diagnosis. Let me go through, whatever tool you use. I will say my book, but let me go through and pull out a code. It's way more than that. Coding is way more than that. That's why we're a STEM program. That's why, we do all of the things that we do, because it's more than just that, right? Right. Okay. So let's say you have a patient who presents for diabetes follow-up. Let's see, their A1C has increased from 7.2 to 8.5. They have a new complaint of numbness in their feet, and they are on multiple medications. So let's think critically about this. Is this a stable chronic illness? What you think? And y'all can talk amongst yourselves in the chat. What's the significance of the numbness? You see, is there something that you need that should, ring bells for you when you see additional things related to the follow-up care for a particular patient? And then how do the medication interactions affect the risk? So see, this is where your clinical thinking elevates your coding, right? Because this now allows you to think not just, oh, here's a diagnosis, let me put a code. No, you need to think all about what is happening, what has occurred in this particular encounter that afford you the opportunity to help this patient's story be told to those payers so that you can get and keep the reimbursement for the services that were being provided, and making sure that you're coding accurately the level of service that is needed for the clinical presentation of this patient. Does it make sense, y'all? Is it helping y'all? Right. Okay. Right. Doesn't sound stable. Absolutely right. Does not at all. So those are some things to really think about as you navigate all of the things here in coding, because sometimes folks don't think through this. And for y'all know, I've been in this game for 25 plus years. I don't understand why y'all don't. And, maybe it's, well, where's my tea? I don't know. But anyway, let's see. So common E&M pitfalls. So these are some common pitfalls that could potentially occur. You're overcounting elements without medical necessity. Remember, we're still just focusing on the medical decision making, but there are some things where folks may still kind of, oh, well, they did all of this. Well, there's nothing to support why they did all of this. And if that's the case, then you're not taking into account medical necessity. And it can be denied because it's not a medically because the medical necessity is not there to support that level of service. And so they can downcode it and say, no, ma'am, no, sir. we're not giving you that level 5 for that condition. Undercoding complex patients. Right. Here's these, and this is where you have the missed opportunities. This is where I said, you could be the star in helping make sure that, or increasing revenue, because you're not undercoding these complex patients. Somebody who doesn't critically think or use their clinical skills to say, wait a minute, this isn't just, just a cut and dry case of XYZ. No, it's not that. This is something a little more serious. This is a little, more advanced. This is a little more acute. This may be something that has progressed, because again, you are bringing that clinical knowledge and that additional validation skill that you have into the fray. So yeah, and that keeps you from undercoding. Missing the clinical significance of a workup, absolutely, and then not recognizing the risk factors. Yeah, all important in leveling your evaluation and management services. So remember, keep in mind, the medical record tells a story, and your job is to understand that story, not just count it. That's a quotable. All right. So hopefully that kind of gives you some additional food for thought as you are either embarking on this coding career and profession, living through this coding career or profession, or even a seasoned coder who may not have gotten this information, and you're like, oh, I didn't know, I didn't realize, I didn't recognize. I don't know why not, but it happens. Things happen, and remember, a good coder knows the rules, but a great coder knows why they exist, right? We talk about that all the time. There's a whole machine that operates on why it is that you're supposed to do what you're doing, why these rules are here based on all of this stuff that's going on. As a coder, you should think clinically first, then code. Understand the why behind the elements that you're looking at, and then trust your critical thinking skills. All right. So I hope this episode helped you. Don't forget to like, subscribe, and hit that notification bell, and share this information with your coding friends. We're all in this together. And while, y'all, I'm putting y'all up on game, and now y'all have something that y'all can share with somebody else, right? So share it with your friends. Sharing is caring. And of course, keep those critical thinking skills as polished as your pearls. Oh, look at that. oh. I don't know. We can certainly ask. There's a question. Will we get the awesome Dr. Jasmine to join on one Saturday morning? Hey, we can always ask. Dr. Jasmine and I have talked a little bit at AHIMA, and yeah, so we can talk. That would be fun, wouldn't it? Because Dr. Jasmine is awesome, and brings a wealth of knowledge. Yes, well, I'm glad. She said she needed the critical thinking moment. Glad. So again, hopefully, you took some pearls away, something that you can share, something that will help you. Yeah, she's a whole vibe, ain't she? And don't even talk about her wardrobe game, ma'am, ma'am. She do all the things, all the things. I love it. I love it. Okay, let's see. Am I doing this right? Yeah, I got the right one. Okay, all right. So, are you thirsty for fresh perspectives on the healthcare revenue cycle? By becoming one of the the PRN sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. So why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. So here's what you can expect as a valued member of the PRNT Sippers. Exclusive healthcare insights, so you can gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And then my personal favorite, the community connection. So join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges like critical thinking. But by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So thank you in advance for considering becoming a member of the PRNT Sippers. For the cost of what, 2 cups of tea or that 1 cup of coffee, you can join the community. Check out the link in the description of the video, or you can go to bit.ly/the PRNT Sippers to join us or get more information. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. Yay. All right, all right. Uh-oh. Look what, yeah, we got the whole vibe. She said she definitely will. All right, Dr. Jasmine. I will be contacting you. So thank you all again for joining the Saturday morning tea or checking out the replay. Let me just ask, was the tea spilled today? Was the tea spilled today? You can put your teacups in the chat. Yes, it was good. Yes. Amen. Amen. If you look good, feel good. Oh, if you look good, you feel good. And if you feel good, you play good. I love me some Deion Sanders. Leave home dressed like you meet your best. Next. All right. Love it. Okay. See, Tanika, look at you. Closed mouth. Don't get fed. We're feeding you over here. Yes, there's teacups. Now, before we sign off, I've got a special request for all you amazing viewers out there. So if you found this episode helpful, and I've asked before, don't keep it to yourself. Share the knowledge with your colleagues by, again, hitting that share button. And hey, why not subscribe to our channel while you're at it? That way, you'll never miss a drop of our health information, compliance, revenue cycle, and medical coding tea. If you have thoughts or questions or experience you want to share about today's topic, we'll love to hear from you so you can continue the conversation and drop a comment in the chat. We can keep this conversation brewing. And if you enjoyed the episode, give us a thumbs up. It helps more healthcare professionals find out about our content. Remember, at the Saturday Morning Tea, we're all about building a community of savvy, informed healthcare professionals. So again, let's grow this community together. So be part of this movement. Now, next week is Thanksgiving, right? And so, she put her teacup in there. Yay. She said I had to ask. I know you did. So we won't have a Saturday morning tea after Thanksgiving. Y'all probably will be shopping to your heart's content, still traveling if those of you are traveling. I do want you all to be safe, enjoy your family, always think about and continue to give thanks for all that you have received, all the blessings that He has bestowed upon us all, the love, the family, all of the things. Even if you are a family of one, go find your friends, have a Friendsgiving, do what you need to love on somebody and be loved on during this time. Wait a minute, she got more. Leave home dressed like you'll meet your best next job. All right, next connection, next opportunity. Absolutely. Don't show up in no bonnet. That's a whole look. That's a whole word. She done gave me a whole word. So, so we won't have a Saturday morning tea, but for those PRN tea sippers, after this session, I'll see you at 10:15 for our meeting after the meeting, where we'll do some additional discussion. I'll talk a little bit more about the CPT symposium. I got some news for you budding entrepreneurs and in the government contracting space. So I'll have some gems to share on that as well. So I'll see you guys at 10:15 a.m. For everybody else, thank you all again for being here or watching the replay. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and have a happy Thanksgiving and have a great weekend. Bye-bye.